let's start na tayo. Recording. So, our session for today is already ongoing on progress sa record natin. Okay, say present if you are on my screen or my board. Okay, Ma'am Buala Nicole Faye.
Yes, ma'am. Morning.
Good morning. Ma'am Jessa Joyce Cambalon. Okay, I think may doon?
Yes siya, ma'am. Nag-message po siya. Di po daw siya maka-unmute.
Okay, no problem. Saan nga ba ako? Balik. Okay, next is Ma'am Crisel Princess.
Present po.
Okay, so Ma'am Hinay Giselle. Present. I think nakita ko na si Ma'am Giselle. And Ma'am Irma. Yan.
Present po.
Okay, so more on group ni Sir Ruben pala to nandito. Okay, so si Ma'am Madera Relosa, I think sila yung mga nagsabi. Tsaka si Ma'am April. And si Ma'am Meme, understand ko na siya. Okay. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Ang 6 ako. Okay, tutuloy natin to kahit tayo lang. Sanay naman na ako sa ganito. Okay, how's your day everyone? So, I hope you were in a good shape. Okay, please take care. Ingat po tayo lagi. Iwasan po natin bumangga-bangga. Ang hirap gumalaw pag may nararamdaman. Okay, so let's recap first our ano ba yung last topic natin last time? Anyone who would like to summarize? What is our topic last time before we start our discussions? Anyone who would like to summarize up our discussion last time, or what have you learned to our lesson last time? Anyone who would like to share their insight rather? Sino po pwede Anyone? Ano lang po natutunan natin last time? No one? Wala kang natutunan, guys? Ano po ang natutunan natin last time? Yan. Galagila ako monitor. Ayan ba to? Bakit? Nakamike ako. Sorry. Ano po? Anyone? Parang wala ata. Yes, Ma'am Giselle. Ano pong naging discussion natin last time? Palibasa, 1 week kasi tayo hindi nagkita, no? Anyone? Assessment?
About assessment and progress monitoring in special education po.
Yeah, that is our subject. Talaga naman. Ano po? Anyone who would like to share their knowledge or learning what have you learned about the topic last meeting? Kasi ma'am, hindi mo sinesend sa sa blue book yung PowerPoint presentation eh. What? How about the different kinds of assessment? What are the assessment to be used before we accept the students to a inclusive program? What is the first thing to do? What do we need? Nako. The importance of assessments in special education in order to provide and put them in their proper placement. Yes. What else? Okay, what is the process na lang? What is the process of assessment? What is the first thing to do before we write our IEP? What is the first thing to do? Bago tayo mag-proceed sa next topic natin. Any idea? Ma'am Joyce, any idea? What is the first thing to do? Sa assessment natin, ha? Ano lang, kahit balibaliktad lang, sige lang. Before we write an IEP, what is the first thing to do? We have to assess who are the professionals. We're talking about here the professionals. And what next? It's actually, another clue, it's actually they are the member of IEP teams. Okay, multidisciplinary teams. Okay, so yung multidisciplinary teams. And who are the members of multidisciplinary team? The first is I have only one student here. At nakamute pa siya. Sige. Kay multidisciplinary team, the general education and teacher and special education teacher. Okay, sila yung partner. PTOTs and most important one is the approval from parents. Good job, Ma'am Nicole. So that's it. That's are the members of assessment team. Aside from that, of course, we need to go to the developmental pediatricians, 'di ba? Uy, gising. Developmental pediatricians, and then developmental pediatrician will diagnose what disability that the child or a person has or have. Then after that, 'di ba, an assessment. Then, bababa ngayon siya. Saan? Sa SPED teacher will assess. Then, we'll call a meeting. Ito na siya. The multidisciplinary team. Okay, before the teacher proceed to the IEP, they have to undergo first the program or a meeting. Plus, huwag nyo kakalimutan yun. This is really important. Okay? Kasi baka may tanungin kayo or anong natutunan natin, okay? Or ano ba yung kailangan natin gawin, and then hindi nyo masagot. Okay, so yun yung pinaka-basic kasi. Like example, okay, you're teaching now. And then you have already the idea of the child. Impressions. Okay, impressions na, oh, I think this child might have, mga ganun. And then, of course, sasabihin mo sa parents yun. Oh, Mami or teacher, what is the first thing to do? Anong gagawin ko? Okay? Yung importante yon, class. Ano ang gagawin ninyo? What is the basic knowledge or basic, let's say, basic idea or basic kasi sabihin mo idea na lang sa parent, anong gagawin nila? Okay? We have to tell the parents that they need to undergo diagnostic tests through development pediatricians, if that case, or psychologists, if the behavior is the matter. Dalawa kasi yun, you have to look up the main problem of the child, or the main disability of the child. Okay, importante yung class, ha. Basic na basic lang yon. Kasi, bakit ko sinasabi yon? Kasi napaka-importante yon. Kasi di mo pwede sabihin, ano na yan? I think autism yan, go na yan, pasok mo na yan sa SPED classroom. Hindi siya ganun. So we need to go to the process para hindi rin tayo, the word itself, ma-technical. Okay? So yan. So now, we will talk about right now. Wait lang. Check ko lang. Baka nababuksan ko. So now, we will discuss the multi-tiered approach to instructions. So we're talking about here instructions na. Kaya ang tinatanong ko kanina, basically, dapat alam na natin what are the needs. Okay, what are the needs before we proceed to the next steps of the IAP. So now we're talking about here the instructions. Okay? So sana magsalita po tayo na baka pag ako na ano sa inyo, pabigyan ko kayo ng report nyo. Sige kayo. Okay, please cooperate, share something. Okay, kung di nyo kaya magsalita on your mic, you can chat your comment, suggestion, or ano doon sa chat box natin. Okay, I also learned din po that ongoing informal assessment should be done to monitor student progress. For example, observation checklist and behavior monitoring. Yes, ma'am. Thank you for that. Please take note of this. Okay, importante yon. The first thing to do is to work your students' progress. It can be on their strengths or it can be their weaknesses. Okay, if you think most needed is the weakness of the child, you have to do on the process. If you think we need to improve their strengths, okay, add more activities or add more program for the child. It depends on the situation. It depends on the capability or capacity of the child. Yung klase, wag tayong pabigla-bigla. Kasi we're talking about here the future of our child or the future of our students, since they have their unique disability. They're not just an ordinary or a regular students or pupil, but they have a unique disability. Yun ang terminology na gagamitin natin. Yes, Ma'am Nicole.
Ma'am, kasi po ma'am, the goal of special education is not only to provide them with the correct placement and education, but also give them hope that they will become better citizens in the future. Kasi po yung stigma of parents with special kids is that like parang hindi na po sila abled up until they grow old. Pero po as special ed teachers, we need to remove that kind of stigma na they are able to and they can strive and look for jobs in the future.
Exactly. Okay. Yun talaga yung pinaka-basic kasi if we have to look back on our foundation of special education, what is the definitions of special educations? It's a program intended to students with special needs. Okay? Intended to special needs, sila uniques. We're talking about here the self-help, self-progress, diba? Yung acceptance of the community towards those children. Yun yung pinaka-basic. We're not talking about here kung ano yung knowledge skills. We're talking about here the knowledge We're talking about here yung future nila, which is Ma'am Nicole, okay, imparted to us. Okay? So, that's it. Thank you, ma'am, for that. Alright, so right now, we're talking about here, okay, try kong ihabol yung curriculum. Hopefully, maano natin yan. Kaya bibilisan ko talaga to para makadalawang strike tayo. Para next meeting, we're talking about here, IEP. We have to write IEP now. Okay? So now, we will discuss right now the multi-tiered approach instructions. Okay, we're talking about here what are the approaches with similar to the methods of teaching. Okay, but here after we assess our students, so what are the approaches to our students after that? Okay, after the assessment. Okay, so medyo maliit, laki natin ng konti, I'm sorry. Ito kasi is insert ko kanina, ay kagabi pala. Alright. So, why RTI? Okay. So, No Child Left Behind requires research-based instructions, intervention by general education teachers for at-risk students. Okay, so these are the most common needs. or needed. Okay? To the child. Okay. Example, reading, math, and behavior. Okay, so basic. So, sabihin natin sa regular classroom, we have the four quadrant. Diba? Remember the four quadrant? Okay, reading, writing, ano ba yun? Yung 4 skills. Okay, listening skills, writing skills, mathematical skills, and the physical skills. So, but here, we're talking about here the the three cycle only. The reading, math, and behavior. Okay, these are the most common needs of the students with special needs. Okay, right now, so Mountain Brooks, okay, multi-tiered instruction model. So, sinearch ko lang siya about this. So, these are the instructions model that to be used. Okay, ano ba yung mga usually common needs of the special needs natin? So 50%, okay, so intensive interventions, individual students, diagnostic assessment, and highly intensity. Okay, so sa academics natin. Okay, hopefully nakikita niyo sila, no? And then, about the behavior here is intensive individual interventions. We're talking about here individual students, assessment-based, intense durable procedures. So it's only 5%. So we're talking about here the okay, so 50% naman here is the okay, it's a targeted interventions, some students at risk. So kaya nga, di ba, we're talking about here risk. Pinag-uusapan natin dito risk. Okay? So leveling para tayo, level 1, 2, and 3. Or mild, moderate, severe. Yung pinaka-apat kasi is the profound. So usually nakikita na sila sa center, again, center, rehabilitation center, okay, sa orphanage center, yan, hospitals, and so forth. Okay, so rapid response, frequent progress, and frequent progress and monitoring. Okay, so how about the behavior? Okay, targeted. Okay, so we're talking about here, okay, some student at risk, rapid response, frequent monitoring, frequent progress monitoring. Okay, so now, so we have here the 80%. We're talking about the research-based core instruction. All students. Okay, prevention, early interventions. Okay, so mataas ang early intervention at age of 3, dapat identified na siya. So what are the cases, or what are the disability, okay, that involve on that academics. Okay, and also, so universal intervention, all settings, all students, preventive, proactive classroom management. So nandito tayo ngayon sa intervention progress. So masyadong mabigat in terms of the needs of the students, especially the classroom management. Okay, so yun ang pinag-uusapan natin. Okay, baka kasi any question about this? I hope not. We'll check that sa monitor.
None, ma'am.
Okay, thank you. Right, so clear. Okay, so interventions versus accommodations. Okay, so please take note of this. Okay, so intervention versus accommodations. Alam naman natin what is interventions and what is the accommodations. Okay, so let's define both. Okay, interventions, okay, so improve skills. Okay, so accommodations, a level playing field. Okay, so what is the level? Okay, it's depend on the chronological age. We're talking about the age and the mental age. Okay, age of what? Age of mental and age for chronological. Yeah. So, ibibase natin yan dito. We have to level the capacity or capability of a child according to their mental capacity. Okay, ano ba yung kaya nila, yung skills nila. So now, we're talking about this scientific research base and are not designed to improve skills sa accommodations. For example, small group instructions sa intervention natin or pre-teaching. Okay, for the accommodation naman, we're talking about here, example, the preferential settings or extended times on test, copy of class notes. So yun yung difference nila. So, more on, we're talking here, pinag-uusapan natin dito is more on the skills. We're talking about here the self-help skills. Okay, so instructions na pinag-uusapan natin. Okay, we're talking about here, the teacher should use appropriate accommodation for all students. So, ibig sabihin, pinag-uusapan natin dito yung accommodations, for all students. We're not talking about tier 1 only students. But it's a matter of modifications. Imo-modified mo lang yung instruction mo individually. It depends on the needs of the students. Okay, not like the regular classroom, we set on 4 activities on one class. Like example, you have 40 students and then you divide your students per 5 ba o by 10 ba. But here we're talking about here individual needs or individual disability. So I hope na gets niyo or nakuha niyo yun. Ano? Okay, so hindi ko na lang i-save. Okay, so tier all students. Okay, so general education teacher responsible. Resource-based strategies program are implemented for all students. Okay, essential standards are re-taught if needed. Enrichment activities are provided if needed. Okay, differentiated instructions is required. Content, process, products based on the student's need is scaffolded. Time to meet with small group to address gaps in learning is set aside. Okay, so yun tayo ha. Okay, next. Okay, tier 2. General education teacher is responsible. Yan, all students. Doon tayo Research-based strategies program are implemented for identify students different from tier 1 program. Ito siya. So, sana hindi tayo nakakalilito, no? So, formative assessment are used regularly. Identify students who need additional supports. Okay, target specific learning needs. Okay, then sa small group instruction occur often, then provided by general education teacher, directly targeted skills deficiencies. Okay, so ano ba yung need? Like example, kung kailangan talaga niya sabihin natin cerebral palsy. Sa cerebral palsy, ano yung basic needs niya? Okay, so saan siya mag-undergo? Sa physical education teacher, kasi yun yung needs niya. Okay, if the problem of a child is a behavior, if that needs to develop to control the behavior, saan ba dapat usually sa values education teachers? If that the child needs of a reading comprehensions, okay, the child must go to the English teacher or the language teachers. So sa math naman, math teachers. Okay, so yun. So basically yun yung mga ina-assess. Okay? R1, timely, structured, mandatory. Okay, so focus on cause of student struggle rather than the symptoms. Okay, so clear. Ulitin natin. Focus on the cause of student struggle, rather than the symptoms. So, saan nga ba siya nahihirapan? Okay? Pinag-uusapan ba natin dito ay alin? Saan ba galing? Bakit siya nag-struggle? Kasi nga, baka mamaya, nagre-read kayo, and then malabo ang mata, nilagay mo sa likod. Dahil nakita mo, big eyes naman siya. Ganun ba yon? Okay, so nag-struggle siya ng behavior kasi someone bully. Okay, so yun tayo. Next. Okay, analyze universal screening data. Okay, develops, aims web, documents, review, etc. To identify students lacking prerequisite skills. We're talking about here, okay, screening data. Ito yung analysis na pinag-usapan. Checklist. Okay? So, I think familiar naman kayo sa aims, web, settings. Then, documents, review. To identify students lacking prerequisite skills. Then provide targeted support before delivering clear instructions to identified students. Okay, supports. If the child needs occupational therapy, speech therapies, behavior therapies, and so on and so forth, or who are the support team needed in the classroom, the shadow teacher, teacher's aides, 'di ba? Yun eh. So we have to identify this para at least madali na lang sa atin kung paano natin sila i-handle. Okay? Basically, saan malalaman yun? Through assessment. Okay? If the child needs support staff or support group, you have to indicate in the IEP. If not, you have to indicate also na you don't need and support. Kasi at least alam nung magbabasa, hindi niya na kailangan kasi naka-in-written naman din sa record niya or sa document niya or sa file niya. If needed, kailangan niya ng support. Okay, so yun. Okay, this is more than just reteaching. Okay, so another one. Documentation for TR. Okay. 2. Lesson plans for intervention listening date, students, time, and interventions. Okay, sa IEP natin, behavior contracts with anecdotal notes, example, behavior charts. So, nakakita na ba kayo ng behavior charts? Similar with parang frame lang siya. Okay, naka-timetable, naka-table siya. Okay, ilang means ba nagmamanifest yung behavior niya? Or yung skills niya? Okay, so yung mga ganong factors. So, you need charts. Okay, charts documenting daily interventions. Usually, naka-record. The student's self-assessment to determine effectiveness of intervention over time. So, you have your activity board. So, nakalagay yun siya. Or, in short, class record na lang. Yan, yun na yun. Okay, class records. Paano natin siya palayuin? Okay, so lahat yun is naka-indicate lahat ng mga records niya, activities niya, ano yung observations mo, naka-indicate yun. Pag nagkaroon siya ng misbehavior during your class, usually, ilang beses nagkakaroon ng ganong activity or ganong behavior, so nakalagay siya. Then, documentations of parents' notifications. If that case, ano yung kailangan malaman ng parents kasi baka mamaya nakapanakit na siya. Kasi remember this class, hindi mo na-record, nagkaroon siya ng behavior in the day. And then may nangyari, this is only the scenario, I'm giving you the scenario class this is happened that hindi mo na i-record o hindi mo na napansin na nagkasakitan yung student mo, and then pag uwi ng bahay ng student mo, nagsumbong yung student 1 mo or student A mo doon sa parent niya, and then nagsumbong. Of course, alam natin ng parents, automatic yan, sumusugod yan sa school without any notification sa parent. Basta, teacher, yung anak ko, sinaktan si ganito, ganyan, o sinaktan siya na ganito. Then, hindi mo na-record yung reasons, yon. What if kung wala pang, napaka-importante talaga yung recording class. Okay? And next, tier 3. Okay, another one is the exact plan determined by SST-based students. Then, another one is this academic intervention or SBR, teacher is responsible. And then, SBR program guarantees intensive supports. And intervention is provided in additional to core instruction and with greater intensity and time. The intervention is intensive, individualized, and based on the problem-solving approach. And then, progress is monitored to determine actual rate of improvement or ROI. Okay? So, yun tayo ha. ROI or rate of improvement. Okay? So, ito yun siya. Susundan mo talaga siya. Okay? Para ma-identify mo if your IEP is successful or need to modify, or your instructions is improved or need to modify or to revise or paraphrase your activity Yun yung basis niya. Sa regular classroom naman kasi, if the lesson plan successful, if not, what are you going to do? Okay? I-remedial classes needed ba? Or you have to put the students to the higher level? Or you have to put your students in the lower level? Yun yung mga basis na pinagsusundan natin. Okay? Next. So, the curriculum base, okay, so CBM naman, we're talking about here, CBM was initially developed more than 20 years ago by Stanley Deno and others at University of Minnesota Institute for Research on Learning Disabilities to develop a reliable and valid measurement system for evaluating base skills growth. Okay? So, CBM is supported by 30 years of school-based research and CBM endorsed by United States Department of Education as method for assessing student progress, which is sinusunod the entire world ba o kasi usually aminin natin US talaga yung nakapag-start ng program ng special education. We Philippines here, we just follow the program and then we modified based on the needs of our students. Kasi nga, di ba class, iba-iba naman talaga kasi ang approaches culturally. Pinag-usapan natin cultural. Okay, matter. Siyempre, iba naman ang culture base ng US in terms of the behavior and approach of the students, right? Okay, Ma'am Nicole always testified on that. Okay, iba yung approach sa US, iba din kasi ang approach ng teacher towards students and parents. May restriction kasi. Masyadong mabigat ang 911. Ano ba? Mabigat. Like here in the Philippines, iba din kasi approaches natin. Medyo may pagka-authoritarian pa tayo konti. Which is with good, no? Medyo may pa tayo konti. May konting power pa ang teachers here in the Philippines. Sa other country, iba din. Okay?
The
Iba.
culture, ma'am, is very, very different.
Yes.
And important, ma'am, when it comes to the approach.
Yes. Kaya nga sabi ko nga, it's depend on the culture. We're talking about the culture. So, we modified our lesson based on the disability of a person, based of the needs of a person. Lagi ko iniliterate yan kasi may madalas na nagipag-away sa akin sa ganyan. Usually mga co-teachers ko which is normal naman. I always told them na we're talking about here the needs of the student. We're not talking about here what is the intelligence of the students Like yung inaano yun, like yung sinasabi dito, we're talking about here the progress, the mental age of the students. Siyempre kasi nga, iba naman talaga yung manner of the regular classes kasi. 'Di ba? Iba naman din kasi ang manner ng special education program natin. Iba 'yon. Yeah, kaya minsan binibiro nila ako, okay, you're part of it. Okay, I accept it. Kasi nga, yun talaga yung reality. Especially kung talagang nasa higher intelligence yung kausap mo and then wala naman idea about special education program or meron na idea man, at least basic lang. Okay, kaya may sinasabi sa kanila, gusto niya ba magpa-seminar ako? Kidding aside, mga birong factors pero may laman para sa akin, lalo pag naaasar na ako. Kasi pinipilit kasi talaga nila yung gusto nilang mangyari. Which is pipilit ko din yung gusto kong mangyari. And which is ito siya. I always give on the legal basis. Kaya ako talaga, naka-legal basis talaga. You know, it's about individualized Disability Act, gumagano ako talaga. Of 2011 that indicated of the students of special needs, gumagano talaga ako. Nilagyan ko ng legal basis. Kasi at least, alam kong sinasabi natin class, pag may legal basis tayo, ito siya. Talking about here the curriculum. Okay. Similar subjects taught, yes, but the approach is different. Okay, tandaan natin to. Okay, Ames Web is in a curriculum base. Ito na yun Okay, measurement. Ano topic to class, no? Okay, so, why CBM? Curriculum-based measurement. Okay, so direct measure of student performance. Okay, we have to talk about here the performance of the students. Ano ba yung capacity ng student natin? Okay, we have to measure the performance. Okay, it is applicable to our level, no? Okay, next. correlates strongly with best practices for instructions and assessments. Okay, what is instructions and assessment? Assessment, instructions. Magka-tandem yan sila. Hindi pwedeng assessment lang. Assess ka ng assess, wala namang instructions. Okay, may instruction ka, wala, hindi mo pa ina-assess. Okay, so dapat magka-tandem yan sila, magkasama. Okay, so another one is correlate strongly with research-supported methods for assessments and interventions. Okay, so assessment and intervention, you have to support. Identify the progress of the child. Teka lang. Okay, ano yung development milestone of a child from 3 years old up to until sa magkaroon sa kanina nakalimutan ko, transition program or placement program. Kasi hindi siya pwede umangat ng placement program or transition program pag hindi pa siya dumaan sa interventions. Ito, class. Kahit pa sabihin ng parents yan, or ma'am, kasi ang anak ko kasi is nasa 18 years old na siya. Konti na lang po magto-21 na siya. Kung nasa 18 years old na siya, pero ang mental age niya is nasa 8 years old, no. Baba talaga siya. Kasi pinag-uusapan natin dito is interventions. Okay? General education, we're talking about year age. Okay. Special education program, we're talking about the mental age. Capacity of a child, capability of the child. Kung hanggang doon na lang talaga yung learning niya, we have to develop only yung knowledge kung ano meron siya. A little by little, dagdag input, 1%, 1%, 1%, 1%, until ma-reach talaga yung capacity niya. Okay, so next is the focus is on repeated measures of performance. Repeated measures of paulit-ulit. Bakit paulit-ulit? Kasi pag hindi walang support, like example, bakit paulit-ulit? Pag walang support sa family, walang support sa community, babagsak pa rin ang performance niya. Teacher, kahit cum laude ka, summa cum laude ka, magna cum laude ka, pag walang support from other, walang mangyayari. Kahit gano'n kakagaling magturo teacher. Pag walang support, babagsak siya. Kaya nga, we need to measure it frequently, paulit-ulit. Para at least, pa-upgrade, pag na-input naman dyan, class, andyan na yan eh. Ang kailangan lang talaga is to maintain the knowledge, maintain the skills, maintain the self-help. Kaya nga talaga, pag paulit-ulit na pinapagawa sa kanila yan para na i-store yan sa brain nila. Or sa memory nila. Okay? Next. Okay, this is only an example lang, class. Hindi ko naman kailangan pang i-discuss. Okay? So, this is an example of rainbow report. Okay? Corrects an error lang naman siya. See? So, medyo, wait lang, gagandahan lang natin ng konti. Medyo parang sakit sa mata na okay, I think this is better. Okay, this is an example, okay, of report sa assessment natin, ha. Okay, so this is are the names, then correct errors. Okay, actually may computation kasi to eh. Okay, yan. Hindi ko napapagawa sa inyo to kasi ayoko din siya gawin. Masyado siyang mahaba. Kasi nung ginawa namin to before, gulong-gulo ko, actually hindi ko din talaga siya naintindihan. Pero, nung naintindihan ko, ayoko din talaga siyang gawin. Ang daming compute. Pero, ang gumagawa kasi to class, hindi naman tayo, don't worry. Teachers, hindi to gagawa. Okay? So, nag-a-assess ang gumagawa nito. Okay, so this is an example. Okay, corrects error accuracy. Okay, well above average. Okay, this is the percentage. Okay, above average, average, below average. Sinasabi ko lang sa inyo ito. Okay, to identify lang siya. So, ngayon, example, ano nga ba yung capacity? Ito yung pinag-usapan natin, iaangat mo ba or ibababa mo? Okay, this is the average, 87. Okay, so nakita siya sa percentage niya na below average siya. Kay teacher, anong gagawin mo? Okay, so since masyado siya mababa, you have to modify your instructions. Okay, pag mataas siya, above average siya, you have also modified your instructions into higher level or to the lower level. Okay, yan yung average niya. Same thing with our class records. Okay, mahina sa math, mahina sa reading, may problem sa behavior, or may problem sa language. Okay, anong gagawin mo? Modify the instructions. Okay? Na ano nyo, nakuha nyo ba o hindi? Paki-thumbs up pag na-gets. Pag hindi, thumbs down. Please, nasa monitor ako. Be honest. Naintindihan niyo ba yung explanation ko or malalabuan kayo or kailangan ko explain again?
I understand,
Yeah,
ma'am.
ang pinag-uusapan natin dito class is yung ano ha, yung tier kanina, ito siya. Yan, babalikan natin kanina, yung tier. Okay. Yan. Okay, the data help indicate the data helps educators answer 3 questions based on this. Okay? So how are the majority of the student progressing who receives general education instruction or RTI? So 80% or plus 50% of the total. So if in just case nakuha niya yung above, itong average sa to, yan, ibig sabihin, possible siyang pumunta sa general education instructions. If not, hindi siya pwede. If lower average, doon pa rin talaga dapat siya sa SPED classroom. Okay? Who are the students who are at risk of academic failure? 5%. So, dun lang siya. Okay, iaangat mo siya, i-modify mo siya, balik sa interventions ba? Okay, babalik siya talaga siya sa from basic. Okay. And then, simple to complex, para pinag-uusapan natin. Ma'am, binilit ng nanay. Teacher, ang anak ko po kasi is nasa nasa 18 years old na siya. Ang sarap sagutin ng, so what? Pero hindi. We have to explain, the assessment is this. Mami, this is the assessment po. Okay, we need to follow the assessment po for the progress of the child. Konting konting pasyente lang po, aangat din ang bata. That's it. We need to focus on the needs of the child kasi po at risk po siya. Kailangan pa po niya na more development, more instructions, more modified strategies, more pagtsatsaga pa. Okay, that's it. Para at least kung if ever na ang bata is nakuha niya na tong level na to, that's at the time na pupunta na siya sa general education instructions. Okay? Okay. How are the high flyers doing and are they progressing? Okay, paano nga ba? If the thing sa structures ng assessment niya isa sa higher level, well, angat. Pag hindi, check the progress. More progress to come. Mga ganun ba? Mga ganun. No, kidding aside. Okay? So, yung mga ganun factors ka. So, kailangan lang talaga tayo, mami, is, at rather teachers, is very, very polite. Tayo, very, yung pagiging cheerful natin, is dapat nandun. Okay? So, para at least, maintindihan ng mga parents, maintindihan ng mga students natin, how the progress goes. Or how the proper, managed properly. Okay? When do I refer student to student support team? Okay? So, SST, student support team. When the documentation of intervention shows Yan. Okay, when do I refer student to student support team? When the documentation of intervention shows, number 1, okay, students is not making progress in identified area of reading or math or any particular subjects or particular activities. Para maging lang tayo, maging aware. Not only for the reading or math or other skills na pinag-uusapan natin. Okay? Intervention for behavior concern is not effective. Okay, pag hindi siya effective, sa tingin mo hindi kaya teacher, anong gagawin mo? Yun. Pag hindi siya, yan, behavior. Okay? Effective ba siya? Effective, not effective, yun siya. So, you need behavior. Oh, I need, behavioral, therapist. Or, yan, behavioral therapist. So, we're talking about the behavior. Or, the concern is the occupational therapy. Hindi pa rin talaga niya kayang maghawak ng pencils. Ang gagawin mo, physical therapist. Kasi baka kailangang i-massage or i-therapy yung muscle bones niya or yan, muscles or bones o yan. Kailangan yon. Okay? Significantly deficient in reading, math, or behavior identified by universal screenings. Okay? So, kasi dahil meron siyang learning disability or meron siyang ito mga to, behavior, or meron siyang ADHD or meron pa siyang anything na may problem pa sa kanya. Okay, so that's it. That is a time na kailangan natin siya ng support team. Okay? Since may problem sa reading, okay? So, kailangan ba natin yan ng shadow teachers or teacher's aid? Yes. O baka may problema siya sa language, lip reading, or kailangan niya. That's it. Okay, another one is this. Okay, SSTD responsible for the decision which ensure that students receive instructions and intervention match to their identified needs. So, ano nga ba yung identified needs na yun? If that's the case, kailangan niya ng sabit support staff na kailangan niya ng more on reading, kailangan niya ng tutorial, language, no? Okay? Another one. Appropriate progress monitoring tools are utilized to provide evidence of student response to instructions and interventions. So, importante dito pa rin yung record natin. Ba't kailangan yung records? To provide evidence. Okay. So, meron kasing PTA meeting, parents-teacher meetings, and other support staff. Okay, na hindi talaga kaya ng bata yung higher level kasi pinilit nga eh. Or kailangan yung bata nasa lower level siya pero ang taas ng progress niya, kailangan niya iangat. Or kailangan niyang i-move into a higher level of instructions. Yun. So, yun yung pinag-uusapan natin dito, class. Another one is a progress monitoring data are used to make timely instructional decision which maximize student outcome. Okay? So, that's it. Instructions of what? Decisions. Okay. Pag sinabi ni student support team na teacher, hindi po talaga niya kaya, we have to undergo more progress activities or we need to pull out. Yan. Mga ganun factors. Kasi, kung yung support team kasi hindi rin talaga niya kaya na i-support yung bata, the entire classes niya or the entire program, they have to decide to move or pull it back. I-pull out yung bata and then dalhin talaga siya sa kung saan siya kailangan ilagay. Okay? So, yeah, that's it. You have to accept. Ganun talaga yung progress niya. Okay, so structure of student support teams. Elementary teams and secondary teams. So, elementary teams, the counselor, general education teachers, presenting teacher, academic interventionists, reading coach, special education teachers, administrators, or other as needed. So, pinag-usapan natin dito yung mga therapist natin. Secondary teams, counselor, administrator, special education teacher, general education teacher, and other as needed. Okay? So, mas marami nasa elementary teams. So, yan. Okay, next. Frequency and durations of meetings determined at school level with minimum of once monthly. At least monthly may progress. Yung iba kasi quarterly. Pero pag ganito mga cases, if sabihin na naka-red tag, okay, alam niyo red tag, pag naka-red tag yung classroom mo, ibig sabihin, different kinds of needs yung nandyan. Okay? So, each referred to students' data should be reviewed by SST monthly. Okay? So, yun siya. Another one, SST responsibilities ensure that screening data are gathered and utilized to verify Tier 1 instructions. Okay, ensure that tiers or TEERs of differentiated, scientific, research-based instructions and interventions are provided with consistency. Ensure that decisions are based on screening procedures, benchmark or testing or progress monitoring. Kasi yan yung mga responsibility ng SST natin. Number one, ensures that screening assessments data are used in selecting individual students' interventions. Ensure that intervention plan includes measurable intervention goals. Number one, ensures that appropriate progress monitoring tools are used. Last, ensure that students transition out of Tier 3. Tama ba yung review ko? Sorry na napindot-pindot ko kasi. Again, number 6. Ensure that appropriate progress monitoring tools are used. 7. Ensure that students' progress monitoring is conducted at minimum of 2 times per month for each student in Tier 3. 8. Review progress monitoring data on specific schedule. Data should be graphed. Goal ROI, achieve ROI should be available for discussions. 9. Ensure that parents of the student receive Tier 3. Okay, meron siya. Intervention are provided with regular data-based intervention progress reports with report cards and mid-term progress reports. 10. Ensure that student transitioning out of Tier 3 are monitored to ensure continued success. Okay, andyan pa ba kayo? Basta. Galaw-galaw. Baka may gusto kayo tanong. Kung wala, we will proceed. Okay. How is SST differentiate from BBSST? Ma'am, parami ng parami ah. Okay. So, it is not plan for accommodation but a plan of intervention. Ito siya. Okay? Plan must include SBR program, intervention for reading, math, and behavior. Measurable goals must be included. Baseline score is determined. Ito tayo sa baba. Desired score is identified. RO is calculated. Progress monitor is ongoing and reported to parents. Okay, goal baseline, number of weeks of interventions. Okay, sa records niyan. Okay, and so on. May tanong po ba tayo? Anyone who would like to ask questions?
None, ma'am.
None? Are you sure of that? Okay. Alam ko, sinend ko na sa ano nyo to eh. Yung isang slides ko. Ito, magpapasok ulit ako ng isang slides. Ano nga ulit to? RTI. Nakalimutan ko. Yan na, nasa ano nyo na. Okay. Please check your blue book. Nakapasok na yung, I think naipasok ko na din yung video presentation na, yung record ko last time, at saka yung PowerPoint presentation ko last time. Kaya I wonder bakit di nyo nakita. Hindi kinakapag nakita yan. Okay, please check your blue book and then you can download the PowerPoint presentation for you to review. And later, isi-send ko naman, wait lang, kasi masyado na mahaba. Do you want